Lord Bishop of Newcastle.
Thank you. Can I start initially by following up on the matter of private sector raised by two of my colleagues with the Minister. And I'm aware that in New Zealand, for example, assisted dying services are available in funeral homes. And I just wondered if the Minister had a view on whether this was in the purview of the bill in terms of private sector. And we know, of course, that funeral homes are not regulated, and we know some of the significant issues that there have been in that domain.
Well, I think what's clear from Article 41 of the bill is that the Secretary of State will, by regulations, set out a detailed operating model. The key parameter for that is that it should be available as free at the point of use. But then the delivery mechanism for it is simply not something that we've set out in detail, because we want to respect the need for Parliament to go through this process, and we think it would be wrong, particularly on a private member's bill, to preempt the will of Parliament in that way. So what we've got in the bill is the foundations for the Secretary of State to be able to make regulations in that context, and the delivery mechanism, whether it's independent or charities, or if you look across the NHS, we use all sorts of different entities to deliver a service, although that service is free at the point of use. For example, general practitioners. I mean, PCNs are, in effect, operate as small businesses, for want of a better word, but that have one key contract, which is with the Department for Health and Social Care, and then through that to the ICBs to be commissioned according to what the population needs as identified by the ICBR. So that is, we work with a whole range of partners and delivery vehicles. The service is free at the point of use, but is often delivered through a range of different mechanisms.
Thank you. Thank you. A question for Sir Chris, if I may. Concerning vulnerable populations and the bill. Currently the bill as drafted would allow the prison population to access an assisted death if they met the other eligibility criteria. And we know, of course, that the rates of mental ill health, self-harm and self-inflicted death are higher in prisons than they are in the general population. Are you concerned that if the bill passes and is available to prisoners, that they may be disproportionately impacted by the bill? And are you concerned that this will also impact on suicide prevention work that happens in prisons?
Thank you very much. So as it happens, I'm actually releasing quite a large report on prison health tomorrow, which doesn't address this question directly, but does deal with things like suicide in prisons, which you might be interested, as you've asked this question, to look at. You're absolutely right, of course, that the prison population is very vulnerable. It's vulnerable, usually medically speaking, before they go into prison. That vulnerability increases in a prison environment for many of them, not to be clear for all, because a structured environment sometimes actually reduces their vulnerability, but that's a point to one side. And one of the main points that I make in the report, actually, is that the prison population is currently younger, but is aging quite rapidly and will continue to age over the next period. So this is not a theoretical question. And at the moment, I have a concern, actually, even before this, that the appropriate levels of palliative care are not available to prisoners. And I do think that it is absolutely essential that we address that point first. I think that the point you raise is a real one, but the principle of prison medical health is that people in prison should have the same rights to health as any other individual, neither more nor less, because it is not to reduce their health that they've been consigned to prison by the law. So I think whatever we do, it should be seen as equally available to prisoners, but with all the concerns that you raise addressed perfectly reasonably, because they apply across a whole sweep of prison health, as the report I'll release tomorrow shows.
Thank you. Can I just then briefly draw that back to the Minister with a related question? According to Marie Curie, 90% of people who die are estimated to need palliative care. So would you feel content if a person who would benefit from receiving this care decided to access an assisted death because they couldn't access the palliative care that they needed to live comfortably in the final months of their life? How realistic is a prospect, do you think, of that with this bill?
Thank you. I think it is vital that everybody is able to access high quality, compassionate palliative and end-of-life care, and that is something that we are working on, and I hope that the £100 million uplift that we provided will go some way to helping on that. We know that there needs to be more research as well into medical conditions that are receiving palliative care treatment, but where that palliative care treatment is not being effective, and sometimes even though palliative care treatment is being provided, the person is still in considerable pain and suffering. So we're investing £3 million in a new policy research unit that will specialise specifically in palliative and end-of-life care. We also work very closely with the Voluntary Community and Social Enterprise Partnership Alliance, Health and Wellbeing Alliance Programme. They're a highly valued partner, people with real expertise from the hospice sector, experts in palliative and end-of-life care, who are constantly feeding back to us in terms of how we can improve the offer and the services across palliative and end-of-life care. And then there are also the 6 challenges that I mentioned earlier in my comments that are going to form the basis of a new palliative and end-of-life care strategy and implementation plan. We want to eradicate regional variation, improve strategic commissioning, improve training. This is really important and urgent work. We are absolutely seized of this as a priority. And I absolutely see, but one thing I would probably welcome is the fact that I think the passage of this bill through Parliament has served to highlight the importance of palliative and end-of-life care, highlight the vital role that hospices play in our community, and is integral to our 10-year plan for the future of our health and care service.
Thank you.
One. Welcome to the 14th and last session of an inquiry into the terminally ill and end-of-life bill. We're joined at this session by Professor Sinead Donnelly, Dr. Jessica Young, Simon O'Connor, and Dr. Jean Snelling. You're all extremely welcome, but I'm going to ask the Bishop of Newcastle to extend to you a welcome in a more appropriate form. Would you like to extend our welcome?
Thank you, Chair. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Atamarie, nau mai haramai, kia koutou katoa. Welcome, welcome, 3 times welcome. Good morning. We are delighted and grateful that you are with us. Kia ora. Thank you.
Thank you very much. I'm going to ask each of you to introduce yourself. We've already received your written materials, but if there's anything you'd like to add before we go into questions, do let us know. Professor Donnelly, would you like to begin? Introduce yourself.
I'm a palliative medicine physician and a general medicine physician working in Wellington in Aotearoa, New Zealand, and with a long 30 years experience in palliative medicine.
Thank you very much. Dr. Young?
Tēnā koutou, ko Jessica Young, toku ikoa. I've been researching assisted dying since the bill was nascent and have spoken to many people over the years that it has been in place. So I'm well positioned to represent the patient and family perspectives today.
Thank you very much. Simon O'Connor.
Well, again, good afternoon. Look, I'm a former member of New Zealand's Parliament. I chaired the Health Committee when we had the then largest inquiry into euthanasia, and was also then part of when the bill was passed through. Very vocal in my thinking around that, and for various reasons with former life, lots of time at hospitals, hospices and around the dying.
Thank you very much. And Dr. Snelling.
Morena, my name's Jenny Snelling and I'm a senior lecturer at the University of Otago. I specialise in health law. I had a prior career before I studied law, and I was a registered nurse for 10 years working in intensive care.
Thank you very much.
Which is, yes.
I've
been working with Jessica on the empirical study that she's leading.